Thank you, Mr. President. I rise today to discuss a couple of pressing issues regarding our healthcare system and ensure Americans are aware of some critical deadlines for their health options in the marketplace. It's that time of year. Healthcare open enrollment has started, and Americans across the country can sign up or change their healthcare plans to make sure they're getting a plan that works best for them and their families. I've long said that the health reform law, otherwise known as Obamacare, is not perfect. And I've been pushing since I've been here to make it work better for North Dakota families and small businesses. But there are many pieces in that healthcare law that are helpful. And I want to make sure that Americans and North Dakotans take advantage during this open enrollment period. Every individual and family should be able to get access to affordable, quality health care. And no one should have to go bankrupt to pay for health care for a child with a disability, a sick family member, or just an emergency that you never thought could happen. That's why I'm encouraging everyone to please make sure you explore your options and sign up for health care coverage. It's more important than ever that folks take advantage of this open enrollment period early, because there are many changes this year that unfortunately make it more difficult for individuals and their families to sign up for health insurance. Even if you already have a plan, it's worth checking out health care plans again as these prices change from year to year. First, open enrollment today is a month and a half shorter this year than it's been in the past. So open enrollment is from November 2nd, right now, until December 15th. That's just 45 days. Do not wait to check this out. It is best if you go today to find out if there is a better plan for you, or if you need to secure health insurance on the marketplace. Second, the administration has significantly reduced funding for in-person assistance called navigators, who help individuals and families sign up for health care coverage. This action is leaving millions of Americans and thousands of North Dakotans without the critical help that they need to understand their options and enroll in meaningful health care coverage. And I want to make a point here. Those of us who in the past have always had the option of getting health care coverage through an employer, there's always someone in that employment office, in the payroll office or in human resources, who helps you through. This is not unique in needing this assistance. It's not unique to the marketplace. It's access and information that you have through your employer if you're getting your insurance through your employer. And the idea was that same opportunity for information should be made available in person on the marketplace. But it's not. And so we have to try and fill in those gaps. And because we have these gaps, we're seeing in many ways, a number of cutbacks, a number of folks not getting access to the information that they need. In fact, Great Plains Tribal Chairman's Health Board does not have enough funds to operate as a navigator, and they will not be able to help North Dakotans sign up for coverage as they have done in previous years. Another navigator in my state, Minot State University, has had its federal funds cut by over 96%. So since 2013, the uninsured rate in North Dakota is reduced from 11% to 9%, in large part because of the work of these navigators. These navigators guarantee in my state, or perform in my state, an invaluable service by guiding families through the process of determining the best private health insurance coverage for them, as well as through traditional Medicaid and Medicaid expansion, excuse me. As many North Dakotans who sign up for coverage qualify for federal assistance to help afford that coverage. So it is so vitally important that they understand Medicaid, that they understand Medicaid expansion, and that they understand the tax implications of the plans that they are selecting. But even those numbers that show the decrease in uninsured in North Dakota don't tell the full story. Not only have navigators responded to daily inquiries during and outside of the open enrollment period, they have identified and responded to the challenges of increasing enrollment, particularly in rural and hard-to-reach areas of the state that are less likely to have access to coverage through an employer. Slashing funding for navigators has implications also for Indian country. Indian Health Service has had challenges delivering quality care to Native Americans in my state and certainly in our region. But those issues have lessened as more Native Americans have enrolled in traditional Medicaid, Medicaid expansion, and private health insurance, enabling these families to access quality, affordable health care to stay healthy. Thanks to the increase of third-party payments, we are no longer limited to life or limb care at tribal IHS facilities in the Great Plains service area. Adding to the turmoil of the enrollment process, the administration also announced it's cutting off federal funding that helps make health care affordable for families, known as cost-sharing reduction payments. As a result, many individuals and families will see their premiums skyrocket by double digits. Due directly to this decision and the uncertainty it has injected into our healthcare system, one insurer has exited the healthcare marketplace in North Dakota, and another has reduced its health insurance plan offerings, leaving many in my counties with only one insurer for consumers to choose from. Ironically, North Dakota was one of the best covered states in terms of options and choices. That option and that source of pride has been diminished as a result of the lack of consistency with cost-sharing reduction payments. A recent report from the nonpartisan Congressional Budget Office said that if the administration stopped paying the cost-sharing reduction payments, as it has now done, there would be serious consequences for individuals and families across the country. The report said families' premiums would jump about 20%. Many families would be left without health insurance options, as a lack of payment would force many insurers to leave the market. It would also add $184 billion to the deficit over a decade. Despite these efforts to sabotage the marketplace and jeopardize access to coverage for families, we have fortunately seen a surge of encouraging enrollment numbers in the first week of enrollment. But the American public deserves better, and I will do everything that I can to ensure consumers know their options, that consumers are connected with opportunities for meaningful coverage, and that they are provided certainty in the future about healthcare costs. On November 1st, I launched a new page on my website, heitkamp.senate.gov, to help provide resources and enrollment information to North Dakotans. I sincerely hope folks who are looking to buy health insurance on the marketplace in North Dakota take advantage of that website. Access to affordable quality health care is a must, and I'm proud to have worked with a group of Republican and Democratic senators led by Senators Alexander and Murray to reach a deal to offer some immediate fixes to make health care more affordable and accessible in North Dakota and across the country. Our bill would specifically address many of the new challenges that face folks during open enrollment. The deal we unveiled last month would provide certainty for insurers and customers by restoring the cost-sharing reduction payments for 2 years and restoring federal funding for outreach and enrollment efforts in states, including the navigator services that I talked about earlier. It incorporates an idea that I've been championing for many years, which is to create a lower-cost copper plan with lower premiums, higher deductibles to increase coverage options for young, healthy families, where they aren't so much worried about the day-to-day cost of health care, but that catastrophic event that could throw them into a lifetime of poverty. The agreement would also provide flexibility for states to continue to explore their options to deliver the best healthcare options to their citizens. This recognizes that one size does not fit all, and that we need to have more flexibility for states to experiment and to provide the kind of quality of care and the kind of care options that work best for their state. On top of having significant bipartisan support, there is a bonus. And the bonus is that CBO and the Joint Committee on Taxation estimate that enacting the legislation would reduce the deficit by $3.8 billion without substantially changing the number of people with health insurance coverage. Now, Congress needs to pass our bill. I've long said there are good parts of the Health Reform Act and parts that need to be fixed. Our bipartisan deal is an important step to help families afford health care coverage so the health reform law works better for North Dakotans. How rare is it in this body to have this many people come together to propose one piece of legislation? I know that if you put this bill onto the floor tomorrow, it would easily pass with over 60% of the United States Senate. We need to get this done. We need to get it done to ensure the American public that we are serious about responding to their concerns about health care, but that we are also serious legislators who can, in fact, fix the problems that we have in this country. I recently introduced a bill to delay that. This isn't everything that we've been working on, but it certainly is the most important and highest priority to pass the Murray-Alexander bill. But there are other proposals to improve health care that I'm working on. I recently introduced a bill to delay the health insurance tax for 2 years and make coverage more affordable for the 156 million consumers across the country impacted by that fee. It would also make the tax deductibility moving forward, providing more certainty for families to plan into the future. Reducing the impact of the health insurance tax, a fee that directly impacts the health care affordability for families and small businesses, has broad bipartisan support. In 2015, Congress passed a 1-year delay of the fee. This delay benefited consumers, seniors, employers, state employees, and tribes, and the average premium reduction from that delay of the fee was 3%. I think if we think about the health insurance tax and we think about sales taxes that many states enact, many states will tell you we don't enact sales tax on the necessities of life, whether it's food, whether it's electricity. This clearly is a necessity of life, having this health insurance. This health insurance tax is nothing more than a regressive sales tax on premium costs, and I believe that we need to find a better and more common sense alternative. Another common sense bill that I've introduced to help make health care more affordable for middle income families is a bill that would address what I call the current cliff problem on premium assistance that many middle class families and seniors face when they earn above 400% of the federal poverty level, putting affordable care out of reach. Right now, those earnings, just a nominal sum over, $1 over the 400% of federal poverty level, which is $47,550 for an individual, $92,200 for a family of 4, are not, the minute you hit that amount, over that amount, dollar over, you're no longer eligible for any premium support to make health insurance more affordable. This perhaps is one of those issues that I have heard more about than almost any other issue in the Affordable Care Act. So what my bill would do is get rid of the cliff and instead insert a slope. The bill would enable more young, healthy families to be able to obtain affordable health care coverage while diversifying the insurance pools. And it would make sure seniors with high medical costs aren't forced to lose those hard-earned retirement savings or go without care. And so smoothing out that cliff will make health insurance more affordable, will make this bill more responsive to our middle-class taxpayers, our middle-class families, and will provide some certainty for these families as they look at the high cost of health care and insurance premiums into the future. I also co-sponsored a bill to provide stability in the insurance marketplace by making the current reinsurance program for individual health insurance market permanent. It would be similar to the successful programs used to lower premiums and spur competition in the Medicare Part B or D program. This reinsurance program would provide funding to offset larger than expected insurance claims for health insurance companies participating in state and federal insurance marketplaces. And it would encourage them to offer more plans in a greater number of markets, improving competition and driving down costs for patients and families. It is that catastrophic cost that is unpredictable for the actuaries that drives up high costs. If they know that that catastrophic cost above a certain amount is subject to a reinsurance plan and those costs are shared more broadly than just within that system, the health care that they can provide and that the insurance commissioners can secure with a reasonable rate would be greatly reduced. Lastly, another critical program that ensures access to coverage throughout the country and in North Dakota is the Children's Health Insurance Program, or CHIP. I have to tell you, I know many, many families who's without CHIP and without their ability to find that temporary opportunity to use CHIP to insure their children, they would be bankrupt today. They would have incurred health care bills just from a simple fall off a swing set. That they would be spending a lifetime trying to figure out either how they're going to pay or they would be finding their way into the bankruptcy court. CHIP is a program that has been used since the late 90s, and more than 2,000 North Dakota children currently rely on it for affordable health care. It provides a critical bridge between Medicaid and private insurance coverage for children. We have to act fast to reauthorize CHIP and let thousands of children across the country who are on CHIP and their families know that we care about them, that we're standing up for them, and we're not going to leave them behind. Unfortunately, the authorization for this critical and life-saving program expired the end of September. Without action from Congress, some states will already run out of federal funding before the end of the year. Some already have and require emergency funding from the Centers for Medicare and Medicaid Services to shore up their programs so that they can still provide that continuous coverage while we fail to act here in the United States Congress. While my state of North Dakota is not scheduled to run out of funding until April next year, this is not a way to administer an ongoing and critical health care program. We need to get this program reauthorized now before it's too late and we have unnecessarily hurt American children and have created unnecessary unpredictability for families who need and have found some incredible benefit in covering their children with this program. The Senate Finance Committee has marked up a bipartisan legislation, Keep Kids Insurance Dependable and Secure Act, to extend authorization for the program for 5 years. Congress needs to act now to make sure that these families know their children have dependable and secure coverage. No parent, no family member should have to wonder if their children will get critical care. Put yourself in their shoes. Since I came to the Senate in 2013, I have said there are parts of the healthcare law and the healthcare system that need improvement to make sure it's working for hardworking North Dakotans and hardworking Americans. These, as I've outlined, are just some tangible common sense policy proposals that have strong bipartisan support. And we can, in fact, make this system better. We can, in fact, tackle this challenge of health care. And then we can roll up our sleeves and reduce costs and make health care more affordable and less costly in this country. We can do all of that. We have a country and a group of American citizens are counting on us to do our job, to make sure that into the future they have the certainty that they need, the predictability that they need to get their health care coverage and to make sure that their families will never have to worry about having to file bankruptcy because a child fell off a swing set. With that, Mr. Chairman, or Mr. President, I yield the floor.